For at least
Ray DeLugalecki remembers when he and his colleagues at Jackson County Health knew that COVID-19 was going to be a big problem.
we saw COVID popping up all across the country with no known ties or connections to other cases that existed. And that is a massive red flag.
And he knew what was likely going to make that big problem worse.
We had no tests.
Meaning, a problem with no borders. Think of it almost like fighting a fire without the ability to contain it anywhere. And when the Big 12 tournament and other events began to shut down, Ray tells me people's response changed almost overnight.
I very distinctly remember the tone of those lines changing almost immediately, from questions about protecting elderly parents or, or their treatments or their tests or any of those sorts of things, to this is impacting me. When is this going to be over? Or, this is something that's interrupting my life. This needs to stop.
We all know now that stopping it wasn't going to be an option anytime soon. Looking back, Ray calls it for exactly what it was.
COVID was a wake-up call for us. It was a demonstration that the infrastructure we had in this community in the United States was inadequate. There's national standards that exist in this country that every public health department should be able to meet. There is only seven agencies in the state of Missouri that met those standards. We were not even close to being able to meet those standards prior to COVID.
Today, that's no longer the case. Everything has changed, even the building in Lee Summit where the health department is now housed. This was a mass testing facility in the COVID days. Now it can accommodate the department's much larger staff. But another of the changes post-COVID, Ray says, still represents a challenge.
We can say we have a good understanding of this, and therefore we can assign a risk level to this. That is very much blurred at this point in society, unfortunately.
Ray tells me everyone has to play their part to avoid the fear and shutdowns we saw last time.
We have a better understanding of risk associated with respiratory conditions. We have the responsibility to not only protect ourselves, but other people in our society is an important aspect of all of that as we move forward.